Welcome to the Listen to Authors section of Korean Journal of Radiology online. It's a great honor indeed to be able to share our work with the readers of KJR. In this study, we developed and validated a model using radiomics features from an apparent diffusion coefficient map to diagnose local tumor recurrence in patients treated for head and neck squamous cell carcinoma. Local tumor recurrence in head and neck squamous cell carcinoma is the main cause of treatment failure, reported more frequently than distant metastasis, and an accurate and early diagnosis is important for timely implementation of treatment and for avoiding unnecessary biopsy in the heavily radiated tissue. However, differentiation between local tumor recurrence and post-treatment change frequently remains as a diagnostic challenge in clinical practice. Role of imaging, especially when it's clinically inaccessible, is important, with conventional images such as T2 weighted image and contrast-enhanced T1 weighted image, as well as advanced imaging such as diffusion weighted imaging. On conventional images, signal intensity similar to that of initial tumor, with evil gray enhancement pattern is characteristic of recurrent tumor. And previous studies have demonstrated lower ADC values in recurrent tumor. Radiomics is a way of converting images into high-dimensional data that can be used as a diagnostic tool and for precision medicine. And MR radiomics have been previously explored in evaluating treatment response in head and neck squamous cell carcinoma. So we applied radiomics to the conventional and diffusion weighted imaging to diagnose local tumor recurrence in head and neck squamous cell carcinoma. This was a retrospective multi-center study from July 2014 to October 2019. Patients with histopathologic diagnosis of head and neck squamous cell carcinoma who completed standard treatment regimen for definitive treatment, who on surveillance MRI developed contrast-enhancing lesion at primary site, and diagnosis of either local tumor recurrence or post-treatment change was made by pathologic confirmation or clinical radiologic consensus. There were 215 patients from Asan Medical Center who were split into training set and internal validation set temporarily, and 70 patients from Seoul National University Hospital used as an external validation set. Radiomics features consisted of 17 first-order features and 87 second-order features, followed by wavelet transformation by the factor of 4, and there was a total of 520 features extracted from each sequence, respectively. After considering for feature robustness and undergoing feature reduction, we applied lasso to select significant radiomic features. Radiomics score was calculated using non-zero coefficients from lasso. And here are the baseline characteristics with 161 patients in the training set, 54 patients in the internal validation set, and 70 patients in the external validation set. And there were no statistical differences in age, sex, and clinical stage groups. Finally, from lasso, there were 5 significant radiomics features from T2 weighted image, 6 significant radiomics features from contrast-enhanced T1 weighted image, and 9 significant radiomics features from apparent diffusion coefficient map. The ADC radiomics model showed higher diagnostic performance than that of T2 weighted image or contrast-enhanced T1 weighted image, both in the training and internal validation set. In terms of clinical parameters, none of the parameters were shown to be significant on the univariable and multivariable analysis. In the external validation set, the performance of ADC radiomics model was also higher than that of T2 weighted image and contrast-enhanced T1 weighted image, and also higher than that of clinical parameters. and the performance of the ADC radiomics model in the external validation set was comparable to that of the internal validation set. So in summary, ADC radiomics model showed higher performance than T2 weighted image and contrast-enhanced T1 weighted image, and higher performance than the clinical parameters in diagnosing local tumor recurrence in head and neck squamous cell carcinoma, and demonstrated robustness in the external validation set. Thank you for your attention.